So if someone asks me what is the difference between strict intake and output versus intake and output, let's touch on it. Strict intake and output is an order that is placed by the provider or surgeon to calculate and monitor over a 24-hour period daily how much fluid a person is taking in and how much fluid a patient is putting out. This means that we need to keep track of how many cups of fluid they're drinking, intravenously fluids or drainage tubings, how much they're putting out, how much urine they're putting out. A lot of times hospitals have a chart that tells you how much one bowl is in mLs or how much one cup is. So you need to look at that. A patient who's on strict I's and O's also might be on a fluid restriction. So you need to take note of that. They're usually a daily weight, frequent vital sign monitoring, frequent laboratory monitoring. Patients who are on strict I's and O's need a urinal. If he's a male, he needs to urinate in a urinal, just like this. And if it's a female, you're going to have to put the hat in the toilet because she's going to need to urinate in the hat. Strict I's and O's, we basically need to know how many mLs they're taking in and how many mLs they're putting out. Intake and output. Let's say a patient urinated 3 times in the last hour. You'll just put 1 count per each urination. So that would be 3. Then you're just going to ask them how many cups they drink of fluid, and you're going to document all of that. It's not as strategic or strict as the strict I's and O's, but it's still necessary. It needs to be documented. I hope you like this video. Subscribe and like.